What's up, everyone? Steve here, your favorite physical therapist. What we're going to do today is go over the 3 common mistakes that people make right after their total knee replacement. So when I say right after their knee replacement, this is for someone that is between the day of their surgery and about 14 days post-op. The number one mistake that people make after their total knee replacement surgery is not taking seriously and not committing to their physical therapy in order to maximize their range of motion. After your surgery, it is a race against time before your knee scars down and stiffens up to maximize your range of motion. You really have about 14 to 21 days to get your range of motion where it needs to be, or else you're going to have an extremely difficult time getting to where you want to be. So when I say not taking your range of motion seriously, that tends to be a 3-pronged approach. That is your physical therapy itself, the home exercise and the range of motion exercises that your physical therapist has provided you or your surgeon. And number 3, that's going to be your positioning. Part 1 and part 2 of that are kind of self-explanatory, doing your exercises that your physical therapist or your surgeon asks you to and participating in them while you're with them. But sometimes people tend to forget the third point there, which is your positioning. Now, if you are sitting in a chair or in a recliner, and let's say you place a small pillow under your knee, and you place your knee in a slightly bent position, if you are seated like that or in that position for 21 or 22 hours a day, and you're only doing, even religiously, an hour or 2 hours a day of exercise, of range of motion, what's going to win? That's the position you hold for 22 hours or the exercise and the activities that you only do for 2 hours? Most likely, it's going to be what you do for 22 hours. Pay attention to your positioning in addition to your exercise program and your physical therapy. The number 2 most common mistake that people make is ignoring pain management. Take your medications as your doctor has prescribed. Particularly in the first week, it's not the time to be a hero, prove how tough you are, and try to avoid taking your medications. Take your pain meds. Your pain meds are going to allow you to get better sleep. It's going to allow you to recover better. It's going to allow you to participate in your therapy, do your exercises better. So you do not want to fall behind on your pain medications. Then you're playing catch up. So taking your pain medication seriously. Also, elevating and trying to manage the swelling. Typically around day 3 or 4, as I said, your swelling can increase. People will feel like they're actually taking a step back, and they almost feel like they're going backwards because their swelling has now increased. When the swelling increases, so does the pain. That swelling is going to put pressure on all the nerves, all the soft tissues. Now you're going to have an increase in pain that is going to make it harder for you to get around and do your exercises. You're going to manage your swelling by either a compression stocking or a compression sock of some sort, and also elevating, keeping your leg above your heart. A standard recliner or even sometimes laying in bed is oftentimes not enough. When I ask people to elevate if they're having a lot of swelling, you really want to get that leg above the heart. Ideally, at least 12 to 24 inches above the heart. You might need multiple pillows under your knee in order to achieve that. The third most common thing that people tend to get wrong is poor hydration and poor nutrition. The research recently in the last 10 or 15 years has become abundantly clear. And that is, if you are recovering from an orthopedic surgery or really any surgery or hospitalization and you're a senior aged adult, for the average 175-pound person, that puts you at about 80 kilograms. That puts you near 120 to 160 grams of protein per day. This is a massive amount of protein. Most people walking around are not eating this much protein. So if you're getting ready to have one of these surgeries, before your surgery, go to the grocery store, stock up on things like Greek yogurt, some lean pieces of chicken. All these healthy sources of protein are what you need and what your body needs in order to, number one, help your tissues recover, right? Help your bones heal, help your incisions heal, as well as helping your body preserve muscle mass in this time. And then also looking at the hydration, it's a pain in the butt to get up, to go pee, to go to the bathroom. Oftentimes people will find themselves inadvertently becoming dehydrated. So we'll always encourage people to check your urine color when they go to the bathroom, when they go pee. If you're showing signs of dehydration, obviously rehydrate. So these are the 3 most common things that I see people do incorrectly after their knee replacement, I wanted to take a quick second because there are some other red flags. These are very rare, but things like blood clots, pulmonary embolisms, infections, all these can happen depending upon the study, somewhere between 1/2 to 2% of the time. So these can happen. They are rare. I didn't mention them too much in this video because the video here was about what is the most common things that people do incorrectly, not the overall worst things that people maybe should be looking out for. Make sure you're taking your blood thinners. Make sure that you're well aware of the signs and symptoms of an infection, things like a low-grade fever, those kind of issues. The purpose of this video was to go over the 3 most common things that people do incorrectly. Hope this video was helpful towards you all. Check out the link below. There's a guide to a total knee replacement. It's free. If you have any questions, leave a question in the comments, and we'll be glad to help out in any way we can.